Hey everybody, it's Luke here, and this is the first video in a 3-video sequence where we're going to look at some different types of back pain and how to kind of self-diagnose. So the basic structure that I'm going to use for these 3 videos is following along with our low back pain and sciatica workshop, where we go through a lot of in-depth information about which type of back pain you have, what causes it. So this is going to be a little bit quicker and just easier to digest in smaller chunks. So in this first one, we're going to kind of pick on the easy one first, and we're going to talk about self-diagnosing if you have a disc bulge. Now, if you know a little bit about disc bulges so far, the discs are those spacers between the vertebrae, which are the bones, and the bulge is kind of like if you picture a jelly donut squirting some jelly out and pushing against the nerve, which can cause pain down your leg, which we call sciatica. So the way you're going to self-diagnose that is just go ahead and put your hands on your hips. And from a side view here, if you bend backwards and you've got a disc bulge which is causing sciatica, in general, that should improve your pain. Okay, so if bending backwards improves that pain that's running down your leg, then chances are you've got a disc bulge. The other way you want to kind of fine-tune this one is do the opposite movement, and if you bend forward, so just the opposite, if that tends to intensify your pain, then again, chances are that you have a disc bulge. So that's the easiest way to test for that one when you're just trying to differentiate what's causing that sciatica. And again, in the follow-up videos, we're going to get into the other 2 ones. The second one is more of a degenerative type thing, degenerative discs and compression and stenosis, things like that. The third one's going to be SI joint pain. And again, like I said, we're kind of picking on the easy one today. Disc bulges, again, are a little more common in younger people, younger active people. Chances are if you're over 55, 60, you're not going to have a whole lot of disc bulges, but you could have some other problems with the disc, which again we're going to get into. So again, that easy self-test is test your sciatica. Should improve going backwards, and it should worsen going forwards. That's a really good indicator that you've got something going on with the disc. If you have questions, let me know. Otherwise, stay tuned for those next videos. Thanks.